Well, you don't have to be Einstein to realise drinking and burglary don't mix.
I'm not a burglar. It was a shed. I needed to get warm.
Yeah, well, I think you'll find the law still defines smashing a window and breaking into a place that ain't your own as illegal.
Trying to find someone.
What, in a shed?
No, in Lethbridge. Got down here last night. I was going to look today. I was told he lived in the area.
Who?
Peter. My son.
Well, they still don't give you the right to break in.
I haven't wanted to find him before, but I thought now he's 21.
Let's see your hand.
I told you it's nothing.
Yeah, well, I'll let the doctor be the judge of that. Go
No,
on.
I want to get out of here as soon as...
Yeah, all in good time.
You sure I'll be able to see someone straight away?
I wish you'd tell me what's wrong.
I'm sure it's nothing, but...
Well, then let me...
I'd rather see a woman.
I am a doctor, and we have been, you know.
There are still some things a girl likes to keep private.
Oh, is that why we didn't last night? Hiya.
Morning. Perhaps I should go to the hospital. The quicker I...
No, let me see who's available.
All right, sorry to get you out again.
That's all right. It's been one of those nights.
Yeah. Mind you, this one shouldn't take you long. Just a bloody nose and a cut to the hand. That and maybe a bruised ego. Mr. Brownlow, being 4 sheets to the wind, was making that much noise he barely got through the window before they called for us. Mind you, I'm not sure what to make of him. Claims he's down there looking for his son. Says they haven't seen each other for years. In my experience, if a kid loses contact with the parents, it's usually for a good reason. That's if he's telling the truth. Of course, he might be going for the sympathy vote. Looks like he'd been living rough for quite some time.
Well, either way, it doesn't sound great, whichever way you look at him.
No, I'll bring him across to your room.
Yeah, thanks.
Why haven't I been discharged yet?
Oh, I expect the doctor will be here soon.
Not that I've got anywhere to go.
Look, I know that you've been there for me in the past, on many occasions, and if it was just up to me...
Mac has every right to be annoyed with me.
I'm not annoyed, it's just...
Who can blame him? But I didn't mean to get in such a state. Things just... well, got on top of me. Surely you can understand that.
Well, of course I do.
Didn't you ever feel that, you know, enough's enough?
You know I have. I do sympathise, but if Mac hadn't...
Made it perfectly plain that I'm not welcome.
Oh, please don't say that.
It's true, isn't it? Lost everything. Ed, Alice, the house, now my friends.
Hey, I'm still your friend and I want to help. Okay. Okay, you can stay, but just for a few days, all right? I mean, we've got to find a long-term solution to this. We've got to find you somewhere permanent to live.
What about Mac?
Don't worry, I'll talk to him.
You won't even know that I'm there.
This is all a waste of time.
Yeah, well, just indulge the doctor for me.
So, how did this happen?
Oh, while you care, patch me up and I'll be out your way. And out of here.
Here, get this on your nose. Sounds bad?
Well, sleeping rough doesn't put you in the best of health.
No, I'm sure it doesn't.
This is all a mistake. I wasn't going to nick anything. I just needed to get warm. I suppose you don't believe me either. You're all the same. What gives you the right to judge me?
I'm not judging you, Mr. Brownlow. I'm just here to treat you. I'll decide whether or not you're telling the truth.
I'll care by the looks of it. No one ever listens.
All right. I'm all ears.
No, it doesn't matter. I'll never find him anyway.
Your son. Custody sergeant told me.
It's probably a wild goose chase.
Why did you think your son was in Lethbridge?
I went back to where he used to live, spoke to some old neighbours. I used to have a job, a home, a family. Then I got made redundant. I was a foreman at a car plant. I got depressed and hit the bottle. Yeah, it's pathetic, really. And then one day you wake up and there's nothing left to fight for. No one cares what you do.
Sorry, you were saying something about your neighbour.
Right. Well, half the neighbours had moved and the rest had either never heard of Peter and his mum, Pam, or claimed they didn't know where they'd gone. Apart from one. Said he'd heard he was at college here. Oh, I expect he said it just to get rid of me. Don't know what I thought I'd do. Knock on every door. It's been 10 years. Well, there isn't a day goes by that I don't think about him.
Yes?
I need to ask a small favour. Is there any chance you could squeeze in my friend Susie before surgery?
I haven't really got time.
She wants to see a woman doctor.
Isn't George around?
I came to you first.
And that's supposed to make me feel better, is it? I wanted to get a coffee and finish this lot off rather than rushing to get it done at the end of surgery.
Please, I'm really worried. I haven't known her that long and...
And?
She won't tell me what it is and... Well, you know...
No, not really. What do you think it is?
Which she might have something I could catch.
Do you mean an STI?
Dr. Thompson will see you. How are you feeling?
Not too bad.
Well, let me take you out to lunch somewhere quiet where you can talk.
About what?
Well, after you've seen Dr. Thompson, we might need to.
Don't, you're frightening me.
Sorry. Look, I'm sure it'll be fine. Where do you want to wait?
There's a new place on the high street.
Anything for you?
Better get something new then. Don't want to be seen in these old things.
Oh, great.
Charmer.
What's wrong with you?
Nothing. It's just there's a time and place, that's all.
Is that the green-eyed monster I can hear?
No! It's just she's the type of woman who really gets up my nose. No one could love her as much as she loves herself.
You must have it bad.
I don't. I just think, surprise, surprise, like every other bloke, he's got hidden shallows.
See you lunchtime.
Why do you think she's seeing Helen? Because you would have thought the one advantage to dating a doctor.
Is that their receptionist would respect their privacy.
Peter always said he wanted to go to art school. He had lovely drawings, even as a kid.
Right, now you need to keep this hand clean.
I don't know what I was thinking of. Even if by some miracle I found him, why would he want anything to do with me? Let's be honest. I'm a disgrace.
How long have you had that cough?
Oh, ages. It's been getting worse lately. And I suppose the fags help.
When did you start smoking?
I had my first one when I was a nipper.
Let's have a look. Okay. Just look up here for me.
There's nothing wrong with my eyes.
Just hold still. Take your jacket off, will you?
What for?
Have you noticed that your right eyelid is droopier than the left? And the pupil of your right eye is slightly smaller than the other one? Also, you've got some red flushing on your right cheek.
I've not really had much need for a mirror. Perhaps I hit me eye as well as me nose. It's probably the booze that's caused the flushing. Red faces are the order of the day where I come from.
Maybe. Can you just turn around for me and lift up your shirt?
I appreciate the concern, Doc. And despite a cell being a lot warmer than the street, I'd still like to get out of here today. What's wrong with you? Haven't you got enough real patience?
I need to listen. I think we should get you to the hospital, just to have a more thorough checkup. I'll go and talk to the custody sergeant, OK?
And I'm not in great shape. I'm sure that's not necessary.
Look, that's a pretty bad cough you've got there. And I wouldn't be doing my job.
OK.
So how can I help?
It only started a couple of days ago. I thought it would go away, but it's got worse. I've tried not to scratch it.
And what is it?
It's a kind of rash, sort of raised and red. You hear so many scare stories.
Well, if you could tell me where the rash
But if I've got...
Look, let's not jump to conclusions. Where is the rash?
That's what's worse. It's down there.
Around the groin area. Right.
They should be able to take you down to the hospital in the next 30 minutes or so.
What's wrong with me? Must be something serious. The coppers don't usually act this fast.
I really can't say. You'll need a chest X-ray.
Doc, you must think it's something where you wouldn't have been poking and prodding me. I promise I won't sue if you got it wrong.
You may have something known as Horner's syndrome. Actually, to be honest, I've only really ever seen it in a textbook when I was at med school, but the main indicators are the different sized pupils, the droopy eyelid, the flushed face. That with your cough.
What's my cough got to do with my eyes?
Well, Horner's syndrome, alongside a cough, can indicate a problem with the lung.
What like?
Well, there's TB.
The hostel people warned us about that. What if homeless have got it?
Exactly. Or it could be...
I'm sure it's TB. Every time I stay at a hostel, I've got someone or other coughing all over me. That's what it'll be.
Isn't there anyone I can contact?
No.
No one from any of the hostels? Well, you'll be in safe hands at St. Phil's.
Why don't you come in with me?
You're sure it's not serious?
No. Like I said, it's quite common. It's called tinea and often occurs in the groin region.
But why me?
You must make sure you dry yourself properly after washing.
It's probably because I'm always in such a hurry to leave the gym. I barely have time to shower. To tell you the truth, I don't even like the gym. But you have got to keep up your standards. A woman should always look her best. I can always get you a free introductory class at my gym.
I really don't have the time.
Believe me, you should always make the time.
Your friend's arrived.
Oh, how'd it go?
It'll, clear up soon.
Anything you need me to get to you?
Isn't he a darling? 1 in a million.
Have you got a prescription? I could get it for you if you want.
Don't be silly. I'll go to the chemist while I'm indulging in a little bit of retail therapy. Mwah. I'll meet you back here later.
Oh, to be a lady who lunches.
Well, once you get your own place, you'll feel much more in control.
I suppose so.
I'll go on to the council about that this afternoon. Hey, what are you doing here?
Hello. Why don't you go on up to the first floor X-ray department? I'll meet you there, okay?
Okay, come on.
Oh, I should be fast asleep at home right now, but medical curiosity got the better of me. Actually, if I'm honest, I feel really sorry for the guy. He's got absolutely no one.
I know how he feels.
You've got me.
How are you feeling?
Oh, okay.
This is Dr. Robinson.
Hello.
We met the other night? Kind of.
Oh. Oh, I'm so sorry. I don't usually get...
Please, forget it. Well, look, I'd better be going. See ya.
I could have done without meeting him.
Oh, thanks again for seeing Susie.
Oh, don't mention it.
She will be all right.
Yes.
You would tell me if there was anything I should worry about.
You mean break patient confidentiality? You should know better than to ask that.
But if it affected other people?
There are procedures for notifying. You have nothing to worry about.
You enjoyed that, didn't you?
Mm-hmm. So, this Susie, is it serious?
You should know better than to ask that.
Touché. What are you doing?
Nothing.
Well, that's certainly true. So why are you standing by the door?
Because I was just...
Never mind, you haven't got time, and neither have I. Listen, I need you to get me the numbers of all the local housing associations and the council housing department. And would you please see to that patient? It might work with other women, but flattery will get you nowhere with me.
We'll see.
So this chest X-ray will tell the doctors why I'm coughing.
It'll help, yeah, although they'll probably want to run some other tests. Look, can I get you some water?
I realise I'm to blame for everything, but I wish things had turned out differently. Sometimes, when I can't get to sleep, which is most of the time on the street, I remember all the outings I used to take Peter on. The zoo, swimming, the park. One year we went to Bournemouth for a week. Peter won a ball for best score on a crazy golf course.
John, are there any family members who might know where Peter is?
No, there's no one on my side, and Pam's sister moved to Australia years ago. Do you think it's TB?
I really don't know. There are other lung conditions.
Like the big C?
Let's just wait and see, okay?
I don't know why I'm so worried. It's not like I've got much to live for. It'd be nice to believe if Peter knew I was ill, he'd come and see me.
Listen, John, I understand that this is hard.
No, you don't understand. How could you possibly know what it's like to not have one person care whether you're alive or dead?
Well, I couldn't really work out what he was saying. And he's so flirty. You should have heard him with Helen. Not being rude, but she's a lot older than him. Which all taken in Faith. Faith.
What?
Listen to anything I've said.
Have you listened to anything I've said? I want those numbers now.
Yeah, I was just about to.
Good. Someone to talk to. He's not much of a conversationalist.
How are you feeling?
Oh, never mind me. I feel sorry for the poor nurse. They just made me spit into a pot.
Yeah, that's so they can do a sputum culture. We can't rule out TB without that.
I see, that's what they think it is.
Let's go in. They found a shadow at the top of your lung, so they want to do what's called a bronchoscopy.
Oh, that sounds painful.
Oh, you'll be given a sedative, and the inside of your nose and your throat will be numbed with a local anaesthetic. Then they insert a tube inside your nostril and guide it down the back of your throat into your windpipe.
Oh, you're joking.
Sorry. But with it, the doctor will be able to see the lining of the trachea and the main airways.
I'm not sure I want to know what he sees.
You are the 5th housing association that I have called, and you've all given me the same excuses. What does it take to find a place to live for someone in this town? Well, thanks for nothing.
I was going to ask if you wanted to go for lunch, but maybe a drink would be a better idea.
It's not even funny. Sorry, Marcia is out of hospital, and I have got to try and find her somewhere to live. The council are totally useless, and all the housing associations say that she doesn't fit their criteria.
Well, I'm not really surprised.
Well, I am. It's ridiculous. If you don't have dependents, you aren't elderly, and you're not vulnerable, and apparently being broke and homeless doesn't count as being vulnerable, then you don't stand a chance of having social housing.
Well, there are only so many places to go around, and there are a lot of people more desperate than Marcia.
How would you know how desperate Marcia is? You don't know anything about her. Oh, sorry, Helen. I really am. I didn't mean to take it out on you.
Where is she now?
She's at our house for a few days. If that. Mac doesn't even know she's there. I've been trying to get hold of him to tell him before he comes back from Dublin, but his phone's off. I can't get hold of Marcia. Honestly, Helen, she was in a really bad way when I left this morning. You know what? I'm gonna go home and see how she is.
Maybe you've been stood up?
What?
Well, she might have met someone with a flashier car or better looking.
Am I really that unattractive?
I wasn't saying that.
Sounded like you were. I mean, maybe you're right. She's a good-looking girl. There must be dozens of men waiting to take her out.
There's nothing special.
Really? Me?
I'm sure whatever areas you lack in, you, make up for in others.
It's good to know. Anyway, as pleasant as it is standing here talking to you about me, I think I'll wait in my room. Oh, ring through as soon as he arrives.
I'm really sorry.
I don't think I really got everything the doc was saying. Did he call it a
Coast tumour, yeah. They call it that because of where it is, at the top of your lung. They're quite rare. Most lung cancers develop in the middle lung.
Oh, did it have to be different?
That's why you have Horner's syndrome, because the tumour is affecting the nerves that control your eyes.
How bad is it? And the bit I did gather doesn't sound like I'm going to be sleeping rough for much longer.
Your symptoms do suggest that the cancer's quite advanced. The thing is, if the tumour has spread too far, then they won't be able to operate. So instead, you'll have radiotherapy, which can prolong your life.
What's the point? A few extra months to do what? They won't be well enough to find Peter. You give me a moment.
Yeah, of course.
What do you think?
Yeah. Very nice if you like that sort of thing. Looks expensive.
It's worth it. Do you want to see what else I bought?
I'm a bit busy.
The sales assistant said this looked as if it was made for me.
Really?
Or do you think this is more suitable for lunch? Can you tell Jimmy I'm here? I'm starving.
She's here.
You should get yourself down there today. They've got some great dresses. There's a few half price.
Yeah, well, I would, but I work.
That's why God invented late night shopping.
Where have you been?
Aren't I worth waiting for?
Absolutely.
Hi, is this the student records department?
Marcia? Oh, hello. Oh, don't worry, I'm only staying for a few days. Julia did try and phone you.
I thought you were in hospital.
I got let out for good behaviour.
Mike, you're back.
Yes. And so is Marcia.
Yeah. I'll just leave you two.
I did try and call you.
You could have left a message.
I was going to, but...
You decided to make a unilateral decision.
Oh, don't be like that.
Like what?
Well, making out that you never have a say in anything.
You said it, Julia.
Look, it's only for a few days, Mac. I am trying to find us somewhere else to live.
And if we have a repeat performance of last time?
We won't.
Well, I wish I could believe that. You've got to admit it, Julia. She's a danger to herself and others.
She's lost everything, Mac.
And I do sympathise. Look, I don't mean to be unkind, but seeing her like that, the smell of alcohol, but it was like I was right back there, like it was only yesterday.
Oh, Mac, I'm so sorry. No, I'm so sorry. Oh, you're absolutely right. I should have talked it over with you first. I should have, especially under the circumstances. I didn't think...
You are doing what's best for Marcia.
No, I can't just ride roughshod over your feelings. You are the person that comes first. I'm going to ask her to leave.
I thought she had nowhere to go.
Well, that's not your problem, is it? And I don't want it to be your problem. I'm going to talk to her now.
No. No, you let her stay. Or maybe I can help her. If she'll listen.
What a waste of a life.
It's not. You had a child, and you loved and looked after him for as long as you could. People make mistakes.
I appreciate you trying to make me feel better, but it's not going to work. I wanted to make amends, say sorry, try to explain. Now it's too late. I was going to say I have to live with what I've done, but it's more that I have to die with it.
You don't know that.
And I can't thank you enough for letting me stay, especially after the other night. But I'm okay now.
Really?
I know I was stupid to get that drunk.
Is that what you usually do when you're upset?
No, of course not. Okay, it isn't the only time I've had far too much to drink, but I'm dealing with a lot.
Yes, I appreciate that. Look, you're not the first or the last person to find solace in a bottle. But if that's the only way that you can
Look,
deal...
I'm fine. I'm not drinking every minute of the day.
That's not the point. The point is why you drink.
It makes me feel good. As though the world isn't quite as grey and as awful as I usually think it is. Just for a few hours I can forget all about my problems. Do you know what I mean?
Yes.
Hey, isn't that why everyone drinks? I mean, we all need to escape now and then.
But drinking till you pass out is not the same as having a few drinks because you want to forget your problems.
What are you trying to say?
I say you are showing all the signs of having a serious drink problem.
No, I'm not an alcoholic.
But you do drink until you hurt yourself.
That was a one-off.
And you do use alcohol to help you cope.
No, I am not an alcoholic. Look, can't you understand? This is a bad time. Once I get myself sorted...
You really believe that?
Yes.
I'm not trying to upset you.
Thanks. But you've got it wrong. Now, if you'll excuse me, I'm going to run a bath.
Why don't you get yourself home to bed? I'm all right, and you've done more than enough.
No, I don't mind.
Peter. Did you?
Yeah.
An explosive start to a new series of BBC1 spy drama Spooks tonight. Don't miss the first of a two-parter at 9.